Hello, I'm Patrick Magovern. I've been a doctor for over 45 years, either very reassuring or slightly alarming, depending on your perspective. I qualified in 1980, nearly half a century ago. I came from a non-medical family, and I remember thinking that medical school would invest me with magical, mystical powers. I'd be able to get people all better. I learned a lot about specific diseases and how to treat them. If the person was sick and you didn't have a disease, you were in trouble. Now, don't get me wrong, it's no small thing. The skills that we learned there's tremendous satisfaction in doing something like treating a frozen shoulder or getting somebody's pneumonia better, or even, dare I admit it, writing a prescription for antidepressants. I also kept encountering a group of patients who simply didn't get better, no matter how hard I tried, no matter how many textbooks I looked at, no matter how thick the textbooks. I couldn't find out what was wrong with the patient. The diseases didn't fit, so I couldn't do much to help. As my career moved on, I found myself practicing in rural and remote medicine in northern Alberta, Canada, the land of the Northern Lights, managing everything from diabetic ketoacidosis to difficult fractures. The broad clinical exposure that I couldn't get in Ireland because we don't have hospital involvement as GPs in Ireland. But this particular group, the people I just couldn't help, stayed with me. I began to travel to seek out doctors who were trying to answer the same awkward questions I was. I found myself practicing in Vancouver at this stage, crisscrossing North America, doing mini learning apprenticeships with physicians who were looking for answers for this often neglected and discouraged group of patients, and looking critically for anything that could be done to help. I was invited to do some part-time teaching in the UCLA Department of Continuing Medical Education, and I found myself working alongside colleagues who had spent decades developing treatment approaches to exactly the kind of patients I was most interested in. Gradually, over years, a different kind of medicine began to take shape for me. An approach less interested in fitting the patient's complaints into a diagnostic box and more interested in understanding how their particular system had gone wrong. There is a huge amount of health information out there, much of it very good, but a lot of what I see online tends to circle around one magic intervention, one test, one supplement, one protocol. It is compelling, it's satisfying to have an answer, but in my experience, the person who walks into my consulting room with chronic fatigue or brain fog or a digestive system that has declared war or pain that won't respond to anything, that person is not a single intervention problem. They're a complex medical story. And the first thing I need to do is to sit down, take time and fully hear and evaluate that person's medical history. I remember one patient not long after I'd returned from Canada. This lady was separated, in her 50s, living alone, working full-time, and she was filling in her history form. Those days, the history forms were filled out in longhand. Under main complaint, she wrote, "By Wednesday, I'm exhausted. By Friday, I'm on my knees. I spend the whole weekend in bed, and then I get up on Monday and do it all over again." I can still remember her well, everything, her name, her face. That was 30 years ago. And that's the kind of patient that I am here for. Honesty matters enormously, especially in medicine. I'm not a miracle worker. However, I do see the majority of my patients get significantly better, not just marginally more functional. But I want to be straight with you, and this isn't a quick fix process that I offer to patients. It requires time, it requires commitment, and as well as my commitment, it needs your commitment. Because so much happens when I can actually meet someone through actually having consultations in person. A lot that happens in the in-person consultation is lost in online consults, which can be transactional. Things that a questionnaire can never pick up. What I'm aiming for might sound modest, giving the dramatic promises that you're going to encounter online, is that when you wake up first thing in the morning, you'll have a reasonably clear head, that you can get out of bed without needing 4 cups of coffee before you can locate the front door, that you've enough energy to get through your day physically and mentally, and that you've stamina left over in the evening for the people you love and for doing something that actually brings you joy, that your mood is stable enough that the people around you are not constantly walking on eggshells. These aren't small things, because for many of the people that I care for, these are enormous things. So that's a little bit about who I am, how I think, and why I do this. In the next few videos, I'm going to talk more specifically about the kind of problems I see most often, especially fatigue, brain fog, digestive issues, chronic unresponsive pain, and a few others. I hope you found this talk useful. And if you see in yourself some of what I've been describing, we're at Martin Clinic, Dublin 14, and my name is Patrick Magovern, and this is the kind of medical work I've been doing for a while.